So our next lecture is going to be focused on how to craft health communication messages. Okay. Uh, for example, when we had COVID-19, you used to receive messages on COVID-19 through our phones, through SMS. Okay. Or when you are actually dialing a phone, dialing or calling someone, you will hear that message about COVID-19. So, what are the guidelines that you can follow in crafting such a message? Okay, that's what we are going to look at. So, uh, our objectives for this session are basically we are going to look at how to design health messages for different audiences and different contexts, and what strategies we can use to make sure that our messages are clear, concise, and persuasive enough. And then we should also be able to know the characteristics of effective health messages. Okay, so health communication messages is basically information, whether audio, written, or visual, that is conveyed to promote health, prevent disease, and improve health outcomes. So basically, just the purpose of health communication messages basically the same as the purpose for what we term as health communication. Health communication basically entails uh, entails systematically planning out health information in order to influence, educate, persuade, and also change people's behaviors, okay, such that they can adopt healthy behaviors and make informed choices about their health. Okay, so for any health messages that we craft, we can choose any of the objectives that we want. We are either educating, we are either influencing or persuading, or motivating people such that they can adopt behaviors that are healthy. So, for any message that you're going to craft, you need to make sure that one, you know who you are sending that message to. What are their needs, what are their beliefs, and what are their values. Okay? This is very important. But if you're sending a generic message, which we saw earlier on, which is that message that is not tailored to specific groups of people, everyone receives the same message, then you also need to how to craft it. Okay? So you need to understand that the audience needs to be at the center of your planning of an effective health message. You should have a clear objective. Okay? A clear objective should be specific and measurable for the behavioral change or action that you want. That means that definitely there is an objective that you want to achieve with your health message. So what is that objective? And then credibility. That means that the health message should not be misleading, should not be what we call misinformation or disinformation. It should be from credible sources, and it is actually structured in a way that does not create confusion. And then emotional appeal. It's important that the messages have an emotional tone to it. When there is an emotional tone to it, it then tends to generate interest, and people may take it at a deeper level. Okay, but overly appealing messages are not also good. It's an issue to do with ethics in communication, or ethics in health communication, which we shall look at. Okay, so use plain or concise language. and then focus a lot on the positives of adopting health behaviors. This is also a principle that is very important in social marketing. Okay, social marketing, you're basically selling ideas, or you're basically making sure that people adopt the behaviors that you want. That's basically like the product that you're selling. Okay, so what is the benefit of adopting the behavior that you want people to adopt? So you focus a lot on that. Um, be concise. Don't pump out a lot of messages that will not have a lot of impact. Okay. Visual appeal. This is to say that you don't necessarily need to overload people with words, but you can actually use pictures, be creative in your messaging, use uh, visual designs. Okay, get a visual artist to make good visuals for you. That this encourages engagement and also memory. And then call to action. Okay, what do you want people to do? That's what you call to action. So if you remember that message on COVID that you receive when you're calling someone, okay, it tells you what to do um, when there is someone that you suspect to have COVID, or how to prevent yourself from getting COVID. So there is a call to action. Make sure that the messages are culturally sensitive. This is a point that we had earlier on discussed. Now, after understanding all these parameters, now you're coming out with with a document that outlines your communication campaign in terms of the objectives, the target audience, the key messages that you want to pass out. The document that has all this is what we call a creative brief. It's what you will use to develop health messages later on. Okay? When you're creating health messages, you need to understand what is the main idea that you're trying to convey about the whole campaign. And then what are the key messages, about this campaign. For example, I think we have 10 days of, is it 10 days of GBV, something? I don't remember that very well. Okay, but the general theme could be about GBV, but there are key important messages that are under that campaign for fighting against GBV. Okay, so you need to understand what concepts are and what messages are. It is very important that when you create these messages, test it out with a smaller population to see if the messages actually don't have issues in terms of meaning, in terms of cultural sensitivity, or whether they actually represent what you actually wanted to push out there. Okay, so you can conduct surveys and find out. It's very important for you to see if the message has been crafted in a very clear way, very relevant, and will actually bring out outcomes that you expect. You can conduct focus group discussions where people actually share about the health messages that you have. They express their emotions and also put out suggestions for improvement. In-depth interviews can also be conducted for the same purpose. Okay, so sometimes you want to make sure that you understand how people perceive messages that you have sent out to them. So you can use high-tech audience testing techniques to be able to get the impression that people have if they see your health message. Okay, so you're basically testing physiological parameters or neuromarketing, what we call neuromarketing methods to assess subconscious responses. Okay, so for example, If there is a TV advert talking about stop drinking, okay, about a campaign on stopping uh, drinking of alcohol, okay, so when that advert runs, you want to see people's facial expressions. You want to see what happens to their brains. You want to see their eye movement. When you look at this, these are basically neural matters related to the neural or the nervous system. Okay, they will tell you whether the messages, all these parameters that I've talked about, the facial expression, the brainwave monitoring, and the eye tracking, they give you information on how people are perceiving these messages. Do they evoke sadness? Do they evoke excitement? This helps us to understand the emotional appeal that the messages carry. Okay, so that is an aspect that can actually be used in crafting health messages. Okay, so these parameters, the physiological and the neural marking techniques, help to give us an insight on the emotional impact of the health messages that we have. Okay, and then the brain monitoring, which basically looks at the brain activity, it helps us to understand the cognitive responses when people see our messages. Okay, and therefore it can be able to gauge patients or the audience's engagement and attention. Okay, if for example you go to YouTube, okay, how there are many YouTube videos on YouTube. So if you have a health campaign that is running through adverts on YouTube, you're basically competing with a number of different videos on different topics. Okay, so you want to understand what makes people to watch your video until the end. So it means that you're competing for engagement and attention. So you need to understand what appeals to people and then be able to craft messages that can appeal to people and generate engagement and attention. Okay. What are the issues with generating health messages? If you have health messages, these health messages may need to be tailored, or they need to be specific to certain groups of individuals. But that also becomes extremely very hard. Targeting people of different socio-economic status and also people of different ethnic origins. This may not be very easy, okay? Okay, because of different preferences, different cultures, different socio-economic classes, different languages that they use. So targeting actually becomes one of the issues. Okay, what can happen is that you can tailor messages that can actually that have a call to action that allows them to use available or existing public health interventions that are existing. Okay, this is very, very, very key in designing very effective health messages. Okay, so that means that you need to understand what their needs are, what their preferences are, and then also understand the existing public health interventions so that your call to action is linked to what is already available. Remember, we talked about the fact that there should be enabling factors. Okay, you tell me to screen for prostate cancer. Okay, but there is no prostate prostate cancer screening center or facility. So that means it doesn't work. But if you tell me to, if you advise me to screen for prostate cancer, and then you tell me where I can screen from, and maybe how much they will charge me, that could be very, very effective. Okay, choose the most effective intervention that is available. Okay, uh, because we have multiple public health interventions about different diseases, but what is the most effective, and then address that. Always make sure that you can always change your health messaging if there is need. So that means that you need to continuously look out for how you can adjust health messages in accordance to new populations that you may have. Okay, know the target group. This is very important because different groups have different preferences, practices, perceptions. So you need to know the group. Conduct studies to understand these groups. Okay, and then identify their needs and be able to address them. And therefore, if you know their needs, then it is possible that you can actually tailor your health communication messages to their needs. So it means that you'll be able to know their needs, what they prefer, and then therefore you'll be able to combine strategies that are relevant to this specific group of people because of their unique characteristics. Okay, so just know that audiences are not the same. People are different. So you need to customize messages to their preferences and needs. Okay, and therefore this is when an aspect of segmentation comes in. Okay, how much the audience is divided into homogeneous groups. Okay, how, and then the degree of customization, which is basically how much the messages reflect the characteristics of the audience. So you need to take note of that. A health message to a youth may be different from an adult of 60 years. Okay, so the messaging will have to be different because of their needs and their preferences. And then you look at what you call computer tailoring, which is basically about combining technology and communication to provide individualized messages at a relatively low cost. Okay, this means that you have you have a theory, or you're basically using evidence-based health information that you are going to pass out to a selected, to specific individuals or to groups of people. That these messages have to be disseminated using a framework or a theoretical framework. Okay, and you will use this expertise of incorporating the theory and the health messages in order to come out with messages that are tailored to individual assessments. For example, with this current era of digital technologies, you can have messages that come to you about perhaps habits that you have been engaged in. Okay, let us say you have you have data about your routines, and then a message that comes directly to you and says, "Hello, Matut, you have not been exercising for the last 3 days. Maybe you could consider exercising in such." Maybe twice a week. Okay, that is a personalized message, which we basically term as a tailored health communication message that comes to individuals. Okay, so when we can use computers to be able to generate tailored messages to individuals. Okay. Okay, so these messages can be personal, based on your personal characteristics, determinants of health and behaviors. And uh, this is made actually in comparison with your desired state of, of health. Okay, for example, we have your phone. Your phone has what we call, you can install what you can call fitness apps. Okay, so with the fitness apps, when you're opening it for the first time, it will ask for your name, your age, your body weight, maybe blood pressure, your pulse. And then it will analyze this information and then give you recommendations and say, uh, you are 2 meters, and the 2 meters in terms of height, and then you weigh 85 kilograms. But at your height and age and weight, you need to be having this kind of weight. Let us say 75. 75 is the desired weight that you need to have. So it will give you instructions on what you can do in order to reach that target. Okay, so that is the personal feedback that comes through, for example, the app. Okay, and then you can have another one, which is normative, which is that for people in your category, in terms of social determinants of health, you are supposed to be weighing maybe, let us say, 75 kilograms, and your blood pressure is supposed to be this and that. So make sure you work towards that, so that you're not outside your peers in the age bracket. Okay? And then another one can be that, okay, for you, in last year, you were having 75 kilograms. This year, you're having 85. That's not right. There's something wrong there. So it is making a comparison about your own, with your own previous states or health states. Okay? So basically, this is to tell you that we can have messages that we send out to people based on their own data, or their own data on their either habits, their biological or physiological parameters, okay, and also their social life. Okay, so that is basically what happens with tailored information or tailored messages, health messages. So people receive messages according to their needs and preferences. The key issue here is that for people to adopt healthy behaviors, you can use the aspect of reinforcement. Positive reinforcement is that you give them rewards, or you make them feel good if they attain their desired states. Okay, so that is also very important. The other issue is that for example, with the apps, it is very important that the apps actually have a personal tone when they are communicating to you. And that's why in the other example I gave you, where the app says, "Hello Matut, it seems this week you have not exercised. Can you consider increasing your duration of exercising to this?" That has a personal tone, because the app is basically sending an information to you, and it has that element of recognizing even your name. And when there is that element in the app, then there is increased attention, and you as an individual gets connected to the message, and then it's likely that you will actually act. Okay, so that means that if you want to have these tailored health messages, you need to understand who you want to target, what's the health problem that you're addressing, which theoretical framework are you going to use, what are the psychosocial determines you're focusing on and what do you want to achieve. Okay, so you may need to have a questionnaire, collect data, and then be able to come up with a database with all this information. And then you can now use that information to create a library and do the different programming. Of course, here you will have programmers and software developers to come up with this computer tailored program that will be able to send messages to people, messages to people that are actually tailored. Okay, so is it very effective? If you send messages to people according to their needs and preferences, yes, it is effective generally, but the effect may not be huge, but it definitely has. Okay, so what are the issues that can influence this effectiveness? Behavior, recruitment, control group, in test of tailoring, and then the theoretical basis. I keep referring to the theoretical basis a lot. I hope you remember that we have theories of behavior change. Okay, so these are the theoretical frameworks that I'm referring to. The health belief model, the trans-theoretical framework, the trans-theoretical model, the diffusion of innovation, social cognitive theory. These are the theoretical frameworks of behavioral change that I'm actually referring to. Okay, so what are the disadvantages? Of course, I've used the example of using apps to be able to send tailored health messages. But you can also have text-based messages. Maybe they are sent to your email, maybe through your SMS, whatever it is. Okay. The other issue is that the targeting may not be the appropriate because you're basically sending information to maybe people who are not actually badly off. Okay, maybe for someone to install their app, it means these are actually highly motivated people and they know what they want. And these are the people that you're telling. Yet the people who are actually, let us say, obese or are under the risky populations, they're not even interested in knowing about messages or even apps that can help them achieve or adopt healthy behaviors. So that's an issue there. Okay. The other issues are related to exposures and re-exposures, which are actually very low in web-based tailored programs. And this makes it very, very difficult to make comparisons at early stages. Okay. So that marks the end of our second presentation. If you have any questions, you're welcome. But basically, we